If you're having trouble sleeping because of your thoracic outlet syndrome, then here's two simple strategies that you can use to get the best sleep you ever had. Adam here from trainmassage.com. And the first strategy is for anybody who has compression on the nerves and blood vessels because of the pec minor. Now, if you're not sure where your pain is coming from, then I have two tests for you to perform at home, with the first one being for the pec minor, of course. What you're going to do is take your affected arm and place it over your head and hold it there for 1 minute. Now, if you begin to feel the same kind of pain as your thoracic outlet syndrome before that 1 minute, that's considered a positive test for the pec minor creating compression. Now, what this test is showing is that the pec minor is so short and tight that the moment you begin to lift your arm over your head and hold it there, it will begin to compress on those nerves and blood vessels, which, for the record, shouldn't be doing it if the pec minor has its normal length. So if your pec minor is creating your thoracic outlet syndrome, then here are a couple of options for you to do. Your first option is to sleep face up with some smaller pillows underneath your arms. What this is going to do is allow some passive contraction within the pec minor so that you're not compressing on the nerves and blood vessels. Of course, you can also try sleeping without the pillows, but then you run the chance of the shoulders getting pulled back gently, which will then gently stretch out that pec minor and can then create your TOS. Now, the second option you can do is to actually perform some self-massage techniques on the pec minor itself right before going to bed. You see, the reason why your muscle is in this locked position is because of the fascia system around it, which locks it in a shortened or elongated position and keeps it from getting stronger or from stretching out. And the best method for releasing that fascia is going to be using self-massage techniques. Take a medium or small ball and place it in the top corner of the chest so you can hit the pec minor. From here, lay on the floor and apply some pressure to that one area. Now, chances are it's going to be tender, maybe even a little painful, and that's okay. Because what your goal is here is to look for a tender spot and apply enough pressure to the point it's a little painful, but not to the point you're not able to breathe. If you didn't know, your nervous system intertwines with your fascia system, which means you need to be able to breathe and relax that nervous system in order for that fascia system to relax as well. So once you find a tender area within that pec minor, you can perform one or all three of these different techniques. The first one is going to be static pressure, where you're just simply hanging out on the most tender spot, taking in big deep breaths and focusing on that pain. The next technique you can do is going to be performing micro movements, where you're moving back and forth and side to side on that one tender spot in order to help increase that blood flow as well. Or you can perform a pin and stretch by pinning down the most tender spots and then taking your arm through its full range of motion in order to stretch out that fascia and muscle as well. You can perform any of these techniques or a combination of them for roughly 3 to 5 minutes right before bed. You can also perform a quick retest after doing it to see if your results improved. And you may be asking, what about sleeping on my side? And my answer is this. If your compression is coming from the pec minor or the chest area, then it's not really a good idea to be sleeping on your side. And the reason why is because when you sleep on your side, your shoulders become stacked, which then allows gravity to slowly push on them, pushing down and down, which then creates that compression within the chest. On top of that, we tend to kind of roll forward a little more whenever we're on our side, which then creates even more compression in that chest area. Now, if your problem isn't the pec minor, then there is another muscle that can also be creating some kind of pain while you're sleeping, and that muscle is the scalenes. To see if this muscle is creating your problems, start off by tilting your head to the opposite side of the painful arm and hold it there for up to 1 minute. If you begin to feel your TOS pain during this test, then that's going to be considered a positive test for the scalenes being tight. If you didn't feel anything, however, then let's move on to step number 2 for this assessment. For step number 2, what you're going to want to do is reach your arm up against the wall with your fingers pointed backwards. Now from here, tilt your head to the opposite side and hold it there for 1 minute. And once again, if you begin to feel pain during this 1 minute that feels like your thoracic outlet syndrome, then that's considered a positive test for your scalenes being tight. Now, if your scalenes are your main problem, then here are a few sleeping positions for you to try to get into. With the first one being sleeping on your side, making sure your head is level with your body. The key here is going to be your pillow. If it's too soft, then she's going to laugh at you. I mean, your head tilts inward and sinks into the pillow, creating compression within the neck. But if your pillow is too hard, then it's going to push your head to the opposite direction, which also creates a kink within the neck. The goal here is to find a pillow that's going to support you in a neutral position. Now, for me personally, whenever I'm sleeping on my side and I want to avoid this kind of kink in my neck, I'll simply just fold up my pillow in order to keep my head in a neutral position. Now, the second sleeping option you have is to once again sleep on your back with your head in a neutral position. I have once again found here that a softer pillow works best because as your head kind of sinks into the pillow, it will create a natural barrier on both sides of it from the pillow itself, which prevents you from tilting your head from one side or another. Now, besides adjusting your sleeping position, you can also perform some self-massage techniques on these muscles as well. To find this muscle, all you have to do is first locate the SCM, the giant neck muscle popping out when you rotate your head, and then go right behind it in order to work on the scalenes. To begin releasing the muscle and the fascia around it, start off by performing some static pressure on the most tender spot using your hand. The key here is not to push directly into the neck itself in order to apply pressure, but to apply just enough pressure inwards to the point you're grabbing the tissues and then drag it towards the back or even up towards the head in order to apply your static pressure. Now, of course, besides static pressure, we can also do some micro movements by moving back and forth and side to side on the most tender spots, or we can perform a pin and stretch by tilting our head to the same side, pinning down the muscle, and then tilting it back the other way as we hold down that tender spots. Once again, your job here is to perform these techniques for roughly 3 to 5 minutes before bed. Now, there is one sleeping position I haven't talked about yet, and that is sleeping on your stomach. And the reason why I haven't talked about this position yet is because regardless of what your pain is or what your problem is, nobody should be sleeping on their stomach to begin with. Think of it like this. When you sleep on your stomach, you have to rotate your head to one side or another in order to breathe for those 8 hours of sleep. Well, if you remain in, let's just say 6 hours of sleep in that position, then that's 6 hours of gravity constantly pushing your body down, which is going to create excessive rotation, not only in the cervical spine, but also the thoracic spine as well. So if this is you, then find a way to sleep on your back or even on your side unless you want a twisted spine. Now, let me be clear. There are other muscles within the body that can also create compression on your nerves and blood vessels, which may also be creating your thoracic outlet syndrome. And the reason why I didn't cover them today is because they're not really relevant to your sleeping position. But if you think your TOS is coming from one of these other areas, then make sure to check out the video in the top right corner. I'll see you over there.